GLAM, Los Angeles.
Hi, Kirby. Hi, Sarah. Welcome to Los Angeles.
Okay, Glams, we have a guest that we are so excited about,
Yep.
Dr. Ashley Brissette. She is an award-winning New York City-based ophthalmologist. She is renowned for her expertise in cataract surgery, LASIK, EVO ICL, Sarah's
My fave.
and dry eye disease, which I am very invested in.
Yeah.
And she's the trusted ophthalmologist of the New York Rangers.
Which is so crazy. I was like, Matt, is that the baseball team? He's like, no, that's the hockey team.
I was like, babe, that's the hockey
Can
team.
you imagine? I mean, that's a lot.
I mean,
like she probably sees a lot.
Like she's won awards and like has had recognition, it says here, with the New York City Super Doctor and Top Doctor.
Yeah.
But I'm like, I feel like it's a badge of honor to be the
Yes.
ophthalmologist of the New York Rangers. Like people's
the pucks
eyeballs
flying at their eyes and the
Truly.
like hockey sticks. Crazy. She is also the Clinique guiding ophthalmologist.
It's very important that your eye products are ophthalmologist
Who
tested.
knew? And it wasn't it's not regulated.
Yeah, I'm using everything on my
Yeah,
eyeballs, babes.
yeah.
Like, I mean, we have to. We're in
Yeah.
there. But Dr. Brissette is not only so knowledgeable, obviously, she's a medical doctor and ophthalmologist, but she understands beauty in a way that I think a lot of other professionals may not.
Right.
Like, she's not like, sorry, you can't wear eye makeup.
Yeah.
And she also understands, like, you're going to hear in this interview, she was like, clean is a marketing term.
Yeah.
I was like,
Right.
hallelujah. Because there's so many times we talk to derms even that are like, well, you know, you want to make sure your products are clean. And I'm like,
Right.
what the hell are you talking about?
Yeah, I feel like I learned so much from her, like how to have an eye routine.
love that I have an eye routine.
yeah.
I felt like an A+ student.
Exactly. Like dry eye disease is super common. Just all of these answers to questions that we have been thinking about. She also answers a lot of listener questions. So it's a really great episode. Very
Yes.
educational.
And thank you to Clinique for partnering with us on this episode. So speaking of your contacts, I didn't have eye issues. Well, not in that regard. I
Yeah.
could see.
Right.
I wanted glasses so bad growing up. So I like faked like
Yeah.
astigmatism or whatever.
Yeah, yeah.
And I remember I got a pair of glasses and I couldn't see with them because
Yeah.
I didn't need them.
Yeah.
So yeah, I thought all the cool kids had glasses. Yeah.
Yeah.
We just put my 2-year-old into glasses.
Oh my God. There's nothing cuter than a
Then
child
getting
wearing glasses.
I agree.
Oh my gosh.
I have like so much sense now for like, I used to tell, parents all the time, oh, just put them on, like find a way to get the glasses on them. When you have a 2-year-old, that's a lot harder to
Yeah.
do. But you're right. And it's so important. Like eye health is like multi-generational, right? It's all the way from we're born to all the way until, we die, that vision is so essential and so important.
Yeah.
And everybody has an eye story like yours with your EVO ICL.
Right.
Yes.
Yes.
And then I was born with congenital ptosis.
Yes.
So the listeners know that. I mean,
Yeah.
Sarah's talked about
Yeah.
her EVO ICL
Yes.
experience, and we had her doctor on the podcast, Dr. Randy
Wu.
Yes. And then I've talked about how, as I've gotten older, Sarah and I are approaching 40. My congenital, you're laughing.
No, I'm laughing because we're like, when is a reader's
No, we're
brand
literally
going
like,
to
do we need a
sponsor us?
monocle? Do we need a magnifying glass? We can't
Yeah.
read any of the writing on these
Yeah.
packages.
We're like, what shade is that?
I was using the Clinique eyeliner today,
Yeah.
like trying to figure out what color it was, and I was like,
Yeah.
black, honey. Okay, good thing I knew that shade existed. Otherwise, I wouldn't be able to read it.
gosh.
A lot of my female patients are like, one thing that's important to me is I want to be able to put on my makeup, and it's like
Yes.
hard to see in the mirror.
Yeah.
Yeah.
As people start to get to that
totally.
age, it's
Yeah, no, it's crazy. Something just flips once you get to your 30s and you're like, wait a minute, I'm waking up with blurry eyes, or like I can't
Yeah.
read as well. And I went to the ophthalmologist last year because I thought like I was losing my vision like very rapidly. And we pinpointed that I think it was like a makeup removing eye product that was just causing me to have blurry eyes. And because I have ptosis remedy surgery, I sleep with my eyes slightly open. So it was dry eye in the morning where like I would wake up and just everything's blurry because I wasn't using, I have to like use lubricating eye drops all day long at this point, which is kind of crazy to think about. But like my mom had to, because my mom had ptosis. She had a blepharoplasty actually to help with that later on in life. But yeah, everybody has an eye story.
Everybody does. And it's so important. And what's really interesting too is it's funny you mentioned dry eye, because dry eye disease is just really, really growing in severity for people, in just the number of people that it affects. it's pretty incredible how much our understanding of eye health as well has changed over the past few years. And even if you think about it, you said that your dry eye was in part caused from a makeup remover. Like in the past, we didn't have any understanding about how cosmetics could affect the health of the ocular surface. But over the past few years, there's been a lot of research into this, and we're really finding an important link between the two.
Okay, we want to get into that. But before we do, we want to know, how did you get into ophthalmology and why are you passionate about it?
Yeah, I mean, it was pretty crazy how it all happened. I went to medical school and I thought I was going to do emergency medicine just because it seemed cool. And like all the cool kids went into emergency medicine and it was really exciting. But I always say there's nothing better than helping somebody see again. And it is honestly the best job in the world. It's a mix of medicine and surgery. And you can learn so much about somebody's total body health just by looking at their eyes and doing an eye exam. I mean, I can look into the back of someone's eyes and see if they have diabetes, high blood pressure, autoimmune conditions. So there's so much about the total body health that comes from an eye exam. So you get to do a ton of general medicine, but then you also help people see better. So I'm so happy that I found it. It is a little bit of a niche specialty, and the technology has changed our profession so much over the past, handful of years. Even since I did my training and I graduated maybe like 9-10 years ago now, things that I'm doing now, we weren't even doing then. And it's just incredible to see the pace of technology and how this has changed the face of medicine, really.
And if you're watching this podcast, Dr. Brissette has the most beautiful eyes.
It's like
I just keep staring into them like, wow.
You have to have beautiful eyes to be a successful ophthalmologist like her.
Yes.
So did you mention that your child has to wear glasses? Did you have to wear glasses growing up?
I did. And I had LASIK when I was in medical school. And it's so funny because it's such a misnomer. A lot of people online, there is some like anti-LASIK sentiment that goes around.
Yep.
But actually eye doctors have vision correction surgery like LASIK or EVO, or, there's many different vision correction surgeries. Smile is another form of it, 3 times higher than the average population. So a lot of eye doctors actually get these vision correction surgeries. So I had LASIK when I was in med school. So happy I did it. Best decision I've ever made. People say this all the time, same to you, like the EVO ICL. There's so many great options to help people see better.
Oh my gosh. I really, my one regret is not getting it done sooner, like when I was like in college or something. But they tell you that your like vision is still changing and that you need to wait. But in actuality, it's not, right? Or you can get it when you're in your 20s.
Yeah.
And it'll last longer.
Exactly. People sometimes wait too long to do something, or maybe they're a little bit nervous, which I totally understand. Because I think when it comes to the health of your eyes and your vision, you definitely don't want to be, going for bargain basement prices or, to be able to get your eye surgery.
Yeah.
So a lot of people sometimes wait, but you don't need to wait that long. As soon as your prescription is stable, you're okay to go ahead for it if you're a good candidate. And the first step is always to see if you're a good candidate for a surgery, because there's many different ways to fix your vision, and your surgeon or whomever you're seeing should really be customizing a plan for you. It's not just okay, everybody gets the exact same thing. We're living in an era of medicine where you can have custom care, and that I think is really going to be the advent of what's going to help people really be able to see better.
What do you think people often get wrong about ophthalmology?
Yeah, I think really people sometimes don't understand the importance of taking care of our eyes and our vision. I think a lot of people take it for granted. I think there's a lot of viral trends that go on online as well, especially when it comes to cosmetic and beauty and skincare and what people will do in and around the eye area. And I see it all as an ophthalmologist. I see all the infections that come out from this. I've seen, people with issues with lash glue getting into their eyes and getting stuck to the eyes, glitter particles trapped underneath the eyelids causing abrasion. So I truly see it all. And I think people don't sometimes understand the importance of taking care of the eyes and the vision, and how the products that we're choosing to use around the eyes can really affect the health of our vision.
Okay, so in terms of health and makeup, what are some of the things that we're doing that are big red flags for you? That you see, with your patients?
Yeah, I think the one is not using ophthalmologist-approved products around the eyes, especially for eye makeup, because it's really interesting. So the old thinking, at least in my profession in ophthalmology, was always just don't wear eye makeup because it's not going to be good for your eyes. And it's really because we didn't have any safety data behind it. You don't have to have a product approved for use around the eye area. You don't have to do ophthalmology testing. And so you can release an eyeliner or a mascara, and it's never been tested in and around the the eye area, but you can put it to market. And so the old thinking was just abstinence only, so just no makeup, and that doesn't work. Like, we know that. People want to wear makeup.
Right.
That's never the right messaging, right? So
Never.
It never
In any
works.
regard. Yeah.
So my whole thinking was like, okay, I think the philosophy instead should be like safe products and like informed, right? And so, for companies like Clinique, which I partnered with a couple of years ago, and it was such just a natural partnership because we were talking a lot in my industry about the importance of eye safety in cosmetics. And I didn't even know this, have been doing this safety testing already for years, so that all of their eye makeup has this, what they call the eye safety promise. So they do ophthalmologist testing in all of their eye makeup products, which makes it easy because if it's a mascara, an eyeliner, anything, ophthalmologist tested, safe for sensitive eyes and safe for contact lens wearers. So you know that any eye product that you're choosing from their eye makeup line is going to be safe for use in and around the eyes, and that it's been truly studied by an ophthalmologist for use in this area.
What does ophthalmologist tested mean?
I was just gonna ask that.
There's
Yes.
a large contingent of people online right now that make content, and they talk about like what certain terms actually mean versus like their marketing definition. And one of them is like dermatologist tested. Like, we hear a lot like dermatologist tested means nothing, but ophthalmologist tested, actually there's a secret sauce to it.
There is, yeah, it's a real thing. And this is not industry standard. And I think that is something that surprises a lot of people. Yeah. So it's not that all mascaras are ophthalmologist tested, right? It has to have that designation. So what it'll be is often a series of tests for a large group of people. So it'll be anywhere from like 50 to 100 eyes, or sometimes even more, where they will study the use of the product around the eye. An ophthalmologist will look under a microscope, which is called a slit lamp, and examine the surface of the eye, looking for things like irritation, redness, swelling. They'll look at the eyelids, the lashes, the skin around the eye, really making sure that there hasn't been a reaction. And if there has been a reaction, then that gets documented and formulas get changed. So it's a really strict guideline and a series of guidelines to get that ophthalmologist testing. So again, this is not industry standard, which is why I always counsel my patients. It's something that they need to be looking out for in products that they're choosing.
Okay. I imagine this is something that costs a lot of money, which is why a lot of brands maybe don't have the money, or they don't want to invest in that way. But is there like a seal? Is there something we should look for?
It'll often have that designation of ophthalmologist tested because that is true claims data.
Okay.
What's interesting, and I think what happens is a lot of people get confused by clean beauty and then it meaning safe. And I think that's a really important distinction to make, because just because something is clean doesn't mean it's been safety tested, right? And clean is more of a marketing term. There will be, like, you guys know this well, there will be standards. It'll be like the Sephora clean standard, right? So for that company, they will have their own set of standards of some products or some ingredients that they do or don't allow. But it is not truly something that is regulated like across the industry, right? And clean doesn't necessarily mean that it has been safety tested for use around the eyes.
Are there any particular types of makeup or skincare products that you, let's say, like, they can't be ophthalmologist tested in a way, or like you're just like, please stop using these products around your eyeballs, please, please, please. You're like, I don't care if they are ophthalmologist tested, I just don't want you using them.
Well, it's really important to just be choosing products for the appropriate place, right? So sometimes people will use skincare with active ingredients, and then they'll think, well, it's okay for my skin, so I'm just going to put it close to my eyes, or just spreading it all over the area. And so that's one thing that I caution people a lot of. Also, if you are somebody that has dry eye or sensitive eyes, you have to be careful with the active ingredients in your skincare, because skincare can also affect the health of the ocular surface in the eyes. So especially dry eye patients, blepharitis, allergy patients, even if you're just someone who's more sensitive eye, again, look at your skincare, look at your cosmetic products, because those are easy things to swap out and to change with products that could be safer for you.
Okay, wait, you mentioned sensitive eyes, and I feel like we're seeing that term pop up a lot, but what is there a formal definition for that?
Yeah. And like, how do you know if you're like it's allergy season?
Yeah.
Or, you know what I mean?
Need a Zyrtec.
Yeah. Or if you truly are using a product that it is causing your sensitive eyes to react.
Yeah, it can sometimes be so hard to determine that, because there are so many things that affect our eyes. I mean, even we are all on screens nowadays, and that hugely affects our eyes. Travel, like even just the air quality can really affect it as well. So sometimes it's really hard to pin down exactly what it is. So I always tell people it's really great to be testing new products as well. So if you haven't tried a product before, test it close to the eye area just to make sure that before you're consistently using it, that you're not going to have an issue. So that's one thing that you can do. And so sensitive eyes, eyes is more just how somebody would identify and really a symptom of an underlying eye condition. So somebody might have sensitive eyes because they have dry eye disease, or they might have sensitive eyes because they have eye allergies. So sensitive eyes is more of the symptom of something else underlying and then what's going on.
Okay.
And what's interesting too is a lot of people don't know that they might have dry eye disease or might have these underlying conditions, which is why it's so important if you're having eye symptoms to see an ophthalmologist, because they might be able to help you really get to the underlying diagnosis as to why your eyes are feeling sensitive.
Yeah, I mean, mine helped me last year. She saw that my left eye was starting to get heavier again because of mitosis, and she was like, you may need to have another remedy surgery potentially. She was like, you could look into Upneek, which is, a prescription that I've used in the past and I love, and I only typically use it in my left eye. But she was like, in terms of you waking up with blurry vision, consider these types of eye drops to help to lubricate the eye before you go to sleep. Like she suggested an ointment for me to use. So I have to put that in my eye at night and then basically be ready to go to bed, which is kind of nice because then I'm forced to stay off my phone before I go to sleep. And then, she was like, if you have a little eye cover, use that. And then also if you wake up and you do feel like you have a burning or stinging sensation because you were sleeping with your eyes open and they got too dry, you can use a little, you can get these compresses at the drugstore to help kind of just soothe the eye.
I mean, so I love to hear this because it sounds like you've established an eye care routine.
Yes.
And I talk about that a lot with my patients and also just online, because a lot of people understand they have a skincare routine, they have a hair care routine, an exercise routine, but not everybody knows that they need to establish an eye care routine. But taking care of your eyes is just as important as your skin, I would argue. And I think a lot of people would feel the same way. But you have a lot of very, very good practices that you're doing to do that. And so usually what I recommend to my patients is also, one, looking at the products that you're using for your eye makeup. So choosing things that are ophthalmologist tested or that have an eye safety promise similar to the Clinique brand for all their eye makeup. And then two, making sure that you're removing your eye makeup before bed, never sleeping in it. That's really, really important. And then three, doing a skincare review to make sure that the products that you're using around the eyes are not harming the surface of the eyes as well. And then incorporating some of these other things that are great for eye health, like good nutrition. The best evidence that we have is for Mediterranean diet, so that's usually what I recommend to patients. And then things like lubricating drops. But we also have a lot of therapies now which are more procedural based to help people with their dry eye symptoms.
Oh, really?
Yeah.
Like what?
Yeah. So we've actually borrowed from dermatology as well. IPL, which is a laser light, which is for rosacea on the face. We have actually now have FDA approved for use in and around the eyes to decrease eye redness, decrease dry eye and inflammation.
Whoa,
so that's a great option.
wow.
Yeah. There's another, which is like a heat and massage treatment called LipiFlow, which is excellent. And then we have others that are radio frequency, muscle stimulation for use in and around the eye area. So again, we're kind of at this advent of being able to treat dry eye disease and other eye health conditions with procedural interventions instead of just saying you have to be using these drops all the time. And drops are effective, especially some of the prescription ones. But for some people, it's a lot. And some people need multiple therapies to be able to feel comfortable again. And it's funny, dry eye disease, people might not think is that big of a deal, but it really affects the quality of your life. And so that's why too, I feel like it's so important for companies to start looking into getting this ophthalmology testing designation for any eye makeup products that they might be creating, which is why I really stand behind the Clinique products as well and all the work that they've done, because the products really can affect, how our eyes feel. And I feel like people don't really understand that. And until something negative happens, sometimes has the perception that it's not that important, although we know that it is.
Yeah.
It's so funny too, because I feel like sometimes people think about safety and they think maybe that the products aren't as showy or not as they won't have as much of a payoff.
Yeah.
Because
Not sexy.
because they're considered safe. So they have to be more clean, not clean in terms of the marketing term, but a more clean look. But I'm wearing all Clinique eye makeup today. And I have very voluminous lashes. I have on a whole shadow thing. I have eyeliner underneath. I was very excited to use them today because I was I felt like I was doing something a part of my in my eye care routine.
Well, and it's so nice knowing that you're not going to suffer because of it. Right.
You feel confident.
Yeah. And you can get the look that you want without having the trade-off of, then having dry and sensitive and irritated irritated eyes afterwards. And a lot of my patients, because I do see people that are probably on the more extreme, where they're seeking out help because they say things like, I want to be wearing makeup again, right? And I haven't been able to do that comfortably in some time. But it's nice knowing that at least we have the safety data behind being able to make these recommendations, and they can get the cosmetic look that they would like without having to sacrifice safety. Yeah.
Can we go back to you were talking about the routine?
Yes.
Do you have a specific routine?
do.
Ooh, yes, tell us the routine. I want to hear this.
So my
I'm like,
routine.
I need to take notes.
Yeah. So for my routine in the PM, I always do a double cleanse for taking off my eye makeup. So I really love a makeup melting balm. So Clinique makes the Melt the Day Away. It is so good. It just melts everything off. And I especially like it because I find you're not having to pull and tug as much on the eyelids and lashes to get everything off. Even if it's like waterproof or anything, it comes and you just like gently rub and everything melts away. And then I do the second part of the cleanse, and I use like a formulated cleanser for in and around the eye area to get anything residual off. And then I use like a hydrating cream under the eyes. And that's like so easy. It's just a 3-step eye care routine, just like you have like a 3-step skincare routine or whatever you'd like to do. But it's really, really important. The removal of the eye makeup, almost as important as the makeup that you're choosing.
Okay, so Ash K. Holm, a very popular makeup artist.
Yeah.
She's incredible. We love her. She actually got me into eye routine.
Yes.
Because she was like, I deal with dry eye. And so she was saying that I believe she talked to her ophthalmologist, but like she has like this whole situation where she sprays hypochlorous acid on her eyes in the morning. And I've started doing that. So I don't wash my face in the morning, but like because I sleep with my eyes open, I get little like eye crusties or whatever. And I grab this little, ophthalmologist approved hypochlorous acid. And I spray it on my eyes. And then I just very gently like wipe any debris away from my lashes and my eyes to clean up that area. And I feel like it's actually soothing to me.
Yeah.
Like,
I mean, not many
love
people,
it.
people don't know that they should be washing over their closed eyelids or removing some of that buildup that's there. I think morning and evening is a great time to be doing that. Like morning when you're in the shower, like evening as a part of your skincare routine. Like everybody knows to brush their teeth twice a day, but they don't know to wash around their eye area twice a day. But it is so, so important. And like so much stuff loves to live on the surface of our lids and lashes. I mean, the function of the eyelashes is really to trap everything in our environment so it doesn't get into the eye. But you need to be washing it off every day, especially if you're someone who suffers from eye allergies, because all of the pollen gets trapped in the lashes. So washing it off is something that can really help, especially if you have a lot of eye allergies.
Oh my gosh. That's why during allergy season, I look like my face blew up because.
Well, I think too, like the eyes show so much.
Oh,
and
totally.
So, and I feel like it's honestly some of the first signs of aging come about in the eye area. Any eye redness is so noticeable. I mean, I have people that will have like a sty and it is like devastating for them, right? Because it like just looks bad. It's like right on your eye. I mean, when people look at your face, the first thing that they notice about you is your eyes. And so you want the eye area to look good. And then you also want it to feel good. Because again, if you have dryness or irritation in the eyes, it can really, really impact your quality of life.
Not to toot Evo ICL's horn once more, but I will say I used to have such dry eyes because I would wear contacts literally
and the contacts
all day.
really contribute.
Because I hated wearing my glasses, and like my, eye doctor would be like, "You have to wear your glasses more." And I'm like, I don't want to wear my glasses. I wear my makeup. My lash extensions would always like hit it. Anyways, I can't remember the last time I've had to use like eye drops. I used to wear them all the time because my eyes were so dry. So just another.
And it's sometimes these like simple changes, right?
You don't even realize.
Yeah.
Like that was not the reason I got it. Like,
Right,
it
but
was
just
for
like-
my vision, but now it's like changed my life.
Yeah.
Question about the AM PM routine, and you have kids. Are you should we like teach our children to do that at an early age?
Yeah, I think it's a great thing to do because once it becomes a part of your daily routine, it's really easy to stay on top of it.
Okay.
I think people are always like, well, I have to add more. Like I already do my skincare routine. I already have this like other routine that I'm doing. But I think once it becomes second nature to you and once you realize how much better your eyes will look and feel, then people really get on board with it.
And like not even if you don't wear makeup.
Even if you don't wear makeup,
yes.
it's just so important as a part of your routine to be washing the eyes. If you're wearing makeup, definitely taking it off every day. Those are just easy things to be doing. I mean, we all make mistakes. I've done it myself. You know, you've had like a night out and you go to bed and you're like, oh my gosh, I wake up, my mascara is smeared. It's like, it happens. But as best you can, taking off the eye makeup every night before you go to bed.
I can't remember the last time I didn't take off my makeup.
Oh,
before,
good for you.
But I mean, probably decades at this point. Honestly.
I think about, I'm like, I'm so lucky I can see, because like in college, contact has fallen out and I put it back in my eye. Like just
I
like,
know,
people do the craziest things.
You're like out and then, you know, you go to, it's literally a miracle I can see. But
You've
anyway,
probably seen some insane
I've
things.
seen it all.
Oh my
And the
gosh.
other thing people do with makeup, like having makeup for years or not switching out their
right.
mascara, like another important conversation to have and to do is to do an inventory of like, okay, how old is this mascara? How old is this eyeliner?
Okay, wait.
Should it be replaced?
So this actually was a question. So we have a bunch of listener questions I would love to hit. How often should we be swapping our mascara, our eyeliners?
Yep. I usually say on average 3 to 6 months for your products. And also make sure you're washing your brushes that you're using in and around the eyes as well. So be good about doing that. But it's important not just for, say, like infection risk, which we know is a huge risk. There was a research study that came out in 2023, and it showed almost 80% of mascaras are contaminated with bacteria. Right? And so for decreasing risk of infection, almost 80% of mascaras that they tested. And not just bacteria, viruses are very easily transmitted in makeup. So be very careful not to be sharing makeup with other people. And even these little parasites called Demodex, which can live on the lashes. And again, those are all things that will make your eyes irritated. If anyone's had a bad eye infection, again, not pleasant. Nobody wants to deal with that. So really important to be replacing the eye makeup regularly.
I got to shout out Allure Magazine for telling me when I was 12 years old, throw out your mascara after 3 months.
3 months. And it also helps with how the makeup will apply and how it wears and looks. You know, if you think about how you're consistently pumping the wand in and out, after 3 to 6 months time, that's introduced a lot of air. It's going to be dried. It's not going to apply as well. It'll be rougher on the application for your lashes. You know, removing it's going to be a lot harder. It might flake off, get into the eyes. So there's so many considerations for doing that.
So blepharoplasties.
Oh,
Hot topic here. I think we recently said this was probably like the #1 surgery in Los Angeles at this point.
I mean, it's exploded.
Yeah.
Yeah.
everywhere.
Everyone's getting one.
Lunchtime surgery.
Yeah.
Is there, someone wanted to know, like in terms of insurance, like what does it depend on and what specialist would you need to see for a consult?
Well, I always recommend what's called an oculoplastic specialist. So they are an ophthalmologist that's done an additional 2 years of training in eyelid surgery. So if you're going to get your lids done, I would strongly recommend an oculoplastic specialist or someone who's specializing in it. You know, again, it's such a delicate area of the body. And because the eyes are right there, again, I've seen negative effects from this. If people are too aggressive, it can cause the lids to not close fully and lead to chronic dryness and also some other vision threatening things. And so if you're going to do it, be very cautious, again, just like anything that you would do with any surgery, in who you're seeing and making sure that they're well qualified.
Yeah. And in terms of the insurance portion, like you would have to go to your ophthalmologist
You would.
and they would have to
Yeah.
like determine that it actually was impairing your vision.
Right.
Yeah. So
Right.
they'll usually do what's called a visual field test, and they'll test it with your eyes naturally as they are. They'll tape up your eyelids and retest it and see if there's a difference. So if the lids are so droopy that they're impacting your vision, then it could potentially be covered by the insurance.
Okay.
Yes. So that's the difference between the
A cosmetic versus a
Right.
functional.
Got it. Can I throw in a question here?
Yeah, of course.
Okay. This is specific to me because I am obsessed with my lash extensions, but also it just like there's a lot of conversation, and we know on TikTok and Instagram, everyone is using the underlash lashes,
Yep.
You know, stacking them, using specific glues to make them last longer. I know that's a separate thing from lash extensions, but what are your general thoughts? I'm sure you have a lot of patients that come in with both, and you know, maybe people aren't properly cleansing the way that they need to. What is like the biggest kind of like red flag around those types of lashes?
Yeah, I think one thing is people get addicted to them, which is like so true. You kind of lose sense of what you, right?
Like caterpillars?
You're speaking.
I like the honesty.
I'm not there yet, but I will be soon.
Yeah, so people start to lose sight of what their normal lashes look like, and then they want to go more and more and heavier and longer. And again, you know, the function of the lashes is to protect the surface of the eye, and it helps with the blink function. And if your lashes are actually too long, or if there's too many, or they're too weighed down, it can impair the blinking, and it can lead to dryness, irritation. It also traps all that bacteria and dust and pollen. And often when people have the lash extensions on, they're not as good about cleaning their lids because they don't want to do anything to disrupt them, right? They've paid all this money to have them put on. So I've seen lots of infections, dyes, all kind of the works from them. But my other thing I will say about it is that people do like to do it. So my attitude is always try it for a special occasion. Like I'm okay for that, but you don't want to be doing it all the time. And another thing that can happen is you can start to get even some lash loss because of the repeated trauma of applying those lashes to your natural lashes. So I've seen people's natural lashes fall out because of it. We sometimes refer to this as like attraction alopecia. So it just like pulls on the lashes so much that they start to fall out.
Yeah.
So again, for a special occasion, I'm fine. You have like your wedding coming up or your honeymoon, you're going to be away for 2 weeks and don't want to have to deal with mascara. Great, give it a try. Go to somebody reputable. If you're someone who's more sensitive skin or sensitive eyes, maybe even do like a patch test of the glue first. Make sure you're not going to react to it because I've seen that before. And just be careful and cautious.
Oh yeah, I got an allergy to lash extensions. We have to try so many different things for our jobs.
I mean, she doesn't need them. Look at her real lashes.
These are my real
Yeah.
lashes, but
Beautiful.
I tested them and then went to an event, and I remember one of my girlfriends was like, you need to get these removed. You look like you are having an allergy attack. It was crazy. My eyes were almost swollen shut. It was bonkers.
Yeah.
We have a question about eyelash serums.
Yeah.
What are your thoughts on those?
I think they can be good. So the OG lash serum was Latisse, which is the only one that's like FDA approved, prescription based, and it has this ingredient in it called prostaglandin, and that's the ingredient that really gives you that wow of like making them grow and fast. This is an interesting ophthalmology fact that I think is interesting. I don't know if anyone else will, but it used to be a glaucoma medication. So the medication for glaucoma, which is a disease that can cause blindness in people as they grow older, and it helps to lower the eye pressures. And one of the side effects is they were like, wow, everybody has these beautiful long lashes. So they actually repackaged it, remarketed it, and created Latisse. But
You did it?
It's the exact same medication. Yes.
Okay,
Yeah.
great.
So, but the one downside to it is that there are a lot of side effects. Although it is very effective, it can cause darkening of the eyelid skin, darkening of the iris, which is the colored part of your eye. And what I think is the worst side effect is that it can cause atrophy of the fat in and around the eyes. So it gives you a very hollowed out appearance. And I see this a lot in my older patients. Nothing will age you more than having hollowed out eyes. So in the vein of wanting to have longer lashes and maybe look more youthful, you'll then have more hollowed out eyes. So you have to be very careful with prostaglandin-based serums. I think there's a lot of great peptide-based serums, and it's a really, really nice alternative. I also think it gives a more natural look to the lashes. They won't probably be as long as one that's prostaglandin or prostaglandin analog, but it'll be a lot safer for you in the long term. So I think that could be a great option.
Yeah, we're seeing a lot of marketing around serums that are prostaglandin free.
Yes, because I
Yeah.
think that messaging finally got out. For a long time, people were so surprised to hear this.
Yeah.
Right.
But then again, it's like podcasts like this where people can start to learn about it. And there's now a lot of science, a lot of research being published, especially in cosmetics use around the eyes. There's this big publication that came out. It's the Tear Film and Ocular Surface publication, everything dry eye that's been published. And there's even a subsection in it, which was about cosmetics on the ocular surface. So people are starting to understand there's more and more research going on.
Amazing.
Yeah.
Love that. So you mentioned screen time earlier.
Yeah.
Does it really affect our vision, and is blue light actually bad?
It's a great question. So screen time can. The reason why is that when we're staring at a screen, we tend to blink less, which can dry out our eyes because we're so focused. It also causes a lot of eye strain because we're focused for up close for so long. So often what we tell patients is to do what's called the 20-20-20 rule. So every 20 minutes, look 20 feet away for 20 seconds. That relaxes the eye's muscles, which are focused for up close. It allows you to blink and to kind of hydrate the eyes, lubricate the eyes, and then go back to your work. So that's usually what we recommend. The blue light is a little bit more interesting. There's not great evidence for blue light blocking really helping with dry eye symptoms or eye strain symptoms. Some patients have told me that they have found an improvement by wearing blue light blocking glasses. So I always say, don't spend a ton of money. If you find it helps, I'm happy for you to do it. There's very little harm, but it is a great marketing kind of term.
Yeah.
The anti-glare screen on the covers on the screen can actually be really useful. There's great evidence for that. Taking frequent breaks, using lubricating eye drops, those are things that have been proven to help.
Awesome. Okay, is there an anti-aging eye health routine to help preserve our visual health?
Yeah, so I would say lubrication around the eyes. So using eye creams. I sometimes get into trouble, I'd say online, with dermatologists who say things like, you don't need an eye cream, just use what you use for your face around your eyes. And I obviously feel very different about that because actives that are in face creams should not be going close to the eyes. You want to be choosing an eye cream. Like Clinique has this great one that I recommend to my patients, the All About Eyes. Very safe for use, very easy to apply, very light. So that's like a great option for people. So using an eye cream for the skin can be useful. Good nutrition is really important. Mediterranean diet, again, is usually what I recommend. It's what we have the best evidence for. Omega-3s are included in that. Colorful vegetables, leafy greens, those are all things that are good for your eyes. And then lastly, and probably the most important, is getting regular eye exams. Because again, we can tell a lot about your total body health just by looking at your eyes. And there are so many eye diseases that can come up as we grow older that are what we sometimes refer to as silent. So things like glaucoma, which can cause permanent damage to your vision, can be caught early to prevent that, but people often don't know that they have that. That's a high eye pressure. So doing things like getting your eye pressure tested, getting your vision tested, usually on average every 1 to 2 years or so is important.
Okay, someone wrote in, and this is something that I actually have heard from quite a few people. Mm-hmm. They said, I got LASIK years ago, but now I can't see. Like they can see, but it didn't, it's reversed and now it doesn't work anymore. Yeah. What are the options?
Yeah, so that's a natural part of growing up. I call it growing up, not getting older. But usually in your mid 40s to 50s, vision starts to decline. It's a part of, age. Yeah. So it's a very normal process. And sometimes people worry that something is wrong. But our eye's ability to focus up close starts to deteriorate usually around 45 to 50. So it's very common that people have had great vision after their LASIK or their vision correction surgery. And then as they get into middle age, things start to change. There are some options. The first would just be using reading glasses. They're inexpensive. You can get the cute if you want. You have a bunch of pairs lying around the house, put them off and on as needed. That's like the easiest, most straightforward option. Sometimes people can go into contact lenses as well. Some contact lenses have the ability to see far away and up close, so it kind of has everything all in one. There's even some new eye drops on the market, which can help to constrict the pupil to give a little bit more reading vision for up close. So there's drops that you can use. So you can talk to your doctor about prescribing that if that's something that interests you. And then if that's not enough, that's when we start to think about other interventions like surgical procedures. So you can always repeat something like a LASIK. What you would do is something called monovision, where you have one eye for distance and one eye for reading. So you get a little bit of everything. Some people love it. Other people's brains do not adapt to that well. So we trial it out and test it out first before doing it in a surgery. And then the last resort would be a lens surgery on the inside of the eye. So using a lens implant, which can fix the vision for far away and up close. So I always think about things in terms of a spectrum. So you can go most conservative to least conservative option. And it's really about finding a plan that's going to work well for you based on you, your age, your lifestyle, your wants and desires.
My parents have the lens replacement.
Yeah.
Is that something that's genetic that you can get from your parents?
Well, everybody will get cataracts in their lifetime if they live long enough. So everybody will. It's a normal part of aging. The lens, which is inside the eye, starts to get thicker and bigger and more cloudy as we grow up. One of my favorite eye facts is if you look at Monet's paintings, his earlier paintings are in more blues and vibrant colors, and then they get more brown and yellowed and more abstract in his later years because of cataract. He couldn't see as well. That's one of my favorite eye facts. Yeah. Cool. So everybody gets cataract in their lifetime. So at some point in your life, everybody will likely require a cataract surgery or this lens replacement surgery.
Got it.
Can you share what your favorite eye drop is? Maybe the brand that you recommend to most of your patients?
Yeah, I really love, so the biggest reason why eyes are dry is because of something that's called meibomian gland dysfunction. So the meibomian glands are the glands that are in the eyelids, and they produce an oil which lubricates your eyes. And often what can happen is that oil can get a little bit congested. It's not flowing as well, or you're not producing good quality oil. And something that everybody hates to hear is topical retinols and retinoid products can actually prevent those oil glands from functioning. So that's a big contributant to dry eye disease as well. So what I like to tell patients is to supplement that oil will give you really good relief from dry eye. So one of my favorite over-the-counter drops is one called Refresh Mega 3. It has an omega-3 in it. Anything that's like a lipid or more of an oil-based drop can be great. Retain is another brand that I frequently recommend that patients really like.
And when you say retinol, do you mean retinol in your normal skincare, not specifically eye? Because
exactly.
we're seeing it in eye serums and eye moisturizers as well.
Exactly. And they're usually at lower concentrations for use around the eyes. But if you're someone who has dry eye or sensitive eyes, you have to be very, very careful, especially with these retinol or retinoid containing ingredients. But even in your skincare, especially prescription ones can. And definitely oral forms. So like Accutane, which a lot of people take for acne, which I completely understand. And it's all about a balance, right? Like nobody wants to have to suffer with acne. And if you need Accutane, I think it's a great medication to be on. But if you develop dry eye, which you might and you likely will, we at least have ways of treating it, but it's just something that people need to be aware of, that it can be a side effect.
Wow. Okay.
Wow.
This was so informative, and I
thank you
love
so
talking to you.
much. Thank you.
It's so nice, obviously, to speak to
A true doctor.
a medical professional, but also, a medical professional that's like very aware of like what's going on in the beauty industry and how people are talking about beauty in this way. Because sometimes I feel like doctors think specifically about diagnosing and it's very black and white, but you obviously have so many different types of patients that come to you, and they care about wearing makeup.
And I want people to feel comfortable asking their doctor about that. And I think just for the longest time, like even as a profession in ophthalmology, it was kind of like, well, just don't do anything, or I just don't know what the answer is. And like one thing I try to do online as well is to get out to other doctors to let them know about this, to let them know about, say, the Clinique eye safety promise, that all of their eye makeup is ophthalmologist tested and safe for sensitive eyes and people that wear contacts, right? Just that messaging, I think, is really important, even to other doctors. Yeah. So the last thing I want is for somebody to go to their ophthalmologist and say, so can I use this eyeliner on my waterline? And then be like, I don't even know what a waterline is, let alone what eyeliner you're talking about. So I think that messaging, even just from a community, needs to get out a little bit more as well. Yeah.
Amazing. Thank you, Dr. Brissette. It was so nice to meet you. Thank you for coming on the pod. Where can everybody find you?
You can find me online. My practice is in New York City, so come see me in New York if you want.
Yes.
I'm on Instagram and on TikTok as well, so you can slide into my DMs, whatever you prefer.
Where's that? What is your handle?
Oh, it's at Brissette MD.
Okay.
Amazing. Thank you.